Did you know that the human male body produces around 1,500 sperm every second? That's over 100 million sperm cells every day. Yet many of us are left wondering what happens to all these sperm cells if they aren't released. Are they just sitting there, waiting for their moment, or do they serve some other purpose? Welcome back to Nature's Cure Quest. Today we're diving deep into the world of sperm production, storage, and some common questions about male reproductive health. We're also going to explore what happens to sperm cells if they aren't released, whether frequent release holds any health benefits, and if there's any connection between consistent ejaculation and the risk of prostate cancer. We'll also tackle the question, does the number of ejaculations really matter? Let's get started. All right, let's start at the very beginning, the production line, so to speak. Sperm development, or spermatogenesis, begins with spermatogonia, the initial germ cells located in the seminiferous tubules of the testes. These diploid cells undergo mitosis to maintain the stem cell population and produce primary spermatocytes. The primary spermatocytes enter the first meiotic division to reduce the chromosome number by half, resulting in 2 haploid secondary spermatocytes. These secondary spermatocytes quickly proceed through the second meiotic division, meiosis II, to form spermatids, which are haploid cells. Spermatogenesis follows, where spermatids undergo morphological changes to become mature spermatozoa. This involves the formation of the acrosome, development of the flagellum for motility, condensation of nuclear material, and shedding of excess cytoplasm. The mature spermatozoa are then released into the lumen of the seminiferous tubules and move to the epididymis, where they undergo further maturation and are stored until ejaculation. This entire process is regulated by hormonal signals, particularly testosterone and follicle-stimulating hormone, FSH. This entire process takes about 64 days from start to finish. However, new sperm cells are continuously being produced, ensuring a constant supply. Now think about this. If you break it down, the human male body produces around 1,500 sperm every second. Multiply that by the number of seconds in a day, and you're looking at a staggering 129.6 million sperm cells produced every single day. Once produced, sperm cells move to the epididymis, a tightly coiled tube located at the back of the testicles. Here, sperm cells mature and gain the ability to swim. This maturation process takes approximately 2 weeks. Did you know that sperm can be stored in the epididymis for up to several weeks? The environment within the epididymis is critical for maintaining sperm viability and fertility. One of the most common questions is, what happens to sperm if they aren't released? The answer is quite fascinating. Sperm cells that aren't released through ejaculation don't just sit around indefinitely. Instead, they are naturally reabsorbed by the body. This process occurs primarily in the epididymis and the vas deferens, where aging sperm cells are broken down and their components recycled. The body reabsorbs these sperm cells through a process called phagocytosis, where specialized cells engulf and break down the aging sperm. The nutrients and proteins are then repurposed by the body, ensuring that nothing goes to waste. For many men, especially during adolescence and young adulthood, nocturnal emissions or wet dreams are a common occurrence. This involuntary release of sperm occurs during sleep, often during REM, rapid eye movement phases, when dreams are most vivid. It's the body's natural way of expelling older sperm cells and making way for new, healthy ones. Now let's address the question of whether frequent release of sperm holds any health benefits. First and foremost, the psychological and physical well-being benefits. Stress relief. Ejaculation triggers the release of endorphins and other feel-good hormones, which can help reduce stress and promote a sense of well-being. Improved sleep. Many men report better sleep quality following ejaculation, attributed to the release of prolactin, a hormone linked to sleep regulation. Enhanced mood. The release of oxytocin and dopamine during ejaculation can improve mood and foster a sense of emotional intimacy, especially during sexual intercourse with a partner. One of the most discussed topics is the potential link between ejaculation frequency and prostate health. Several studies have explored whether frequent ejaculation might influence the risk of developing prostate cancer. Here are some findings. Prostate cancer risk reduction. A landmark study published in the journal European Urology found that men who ejaculated more frequently, at least 21 times per month, had a significantly lower risk of developing prostate cancer compared to those who ejaculated less frequently. Prostate fluid clearance. Regular ejaculation helps clear the prostate gland of potentially harmful substances, reducing the risk of inflammation and infection. Inflammation reduction. Frequent ejaculation may reduce inflammation, which is linked to cancer development. Hormonal regulation. It could help in regulating hormones that are involved in prostate cancer progression. While these findings are promising, it's important to remember that correlation does not equal causation. More research is needed to fully understand the relationship between ejaculation frequency and prostate health. Now let's focus on some myths surrounding sperm production and ejaculation. Let's debunk a few of them. Myth number 1. Frequent ejaculation reduces sperm count and fertility. Fact: while frequent ejaculation may temporarily reduce sperm count in the short term, it does not have a long-term impact on fertility. The body continually produces new sperm. Myth number 2. Abstaining from ejaculation increases testosterone levels. Fact: while short-term abstinence may cause a slight increase in testosterone levels, there is no significant long-term impact on overall testosterone production. Myth number 3. Sperm production decreases significantly with age. Fact: while sperm production may decline somewhat with age, many men continue to produce healthy sperm well into their later years. Now let's discuss the role of lifestyle factors. Maintaining a healthy lifestyle is crucial for optimal sperm production and overall reproductive health. A balanced diet rich in antioxidants, vitamins, and minerals supports sperm health. Foods like nuts, seeds, fruits, and vegetables are particularly beneficial. According to research, diets high in omega-3 fatty acids, zinc, and folic acid can significantly improve sperm quality. Regular physical activity helps maintain a healthy weight and reduces oxidative stress, which can negatively impact sperm quality. Studies show that moderate exercise can boost sperm motility and overall reproductive health. Avoiding toxins. Limiting exposure to environmental toxins, such as pesticides and heavy metals, and avoiding smoking and excessive alcohol consumption can improve sperm health. Smoking in particular has been shown to reduce sperm count and motility significantly. Prostate cancer is one of the most common cancers among men. Understanding its risk factors and potential preventive measures is crucial. According to the American Cancer Society, about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. While age, family history, and race are significant risk factors, lifestyle choices also play a role. As mentioned earlier, some studies suggest that frequent ejaculation may lower the risk of prostate cancer. While frequent ejaculation may be beneficial, it's essential to adopt a holistic approach to prostate health. Dr. Charles Ryan, a professor of clinical medicine at the University of California, San Francisco, suggests that moderation is key. He advises men to focus on overall well-being, including a healthy diet, regular exercise, and stress management, rather than fixating solely on ejaculation frequency. Besides having a healthy diet, exercising regularly, and avoiding toxins, men over 50 should consider regular prostate screenings, such as PSA, prostate-specific antigen tests, and digital rectal exams. Today, we've journeyed through the incredible world of sperm production, storage, and the natural processes that take place when sperm isn't released. We've explored the potential health benefits of frequent ejaculation, discussed the intriguing connection between ejaculation frequency and prostate cancer risk, and answered the question of whether the number of ejaculations truly matters. Remember, understanding our bodies is key to maintaining overall health and well-being. If you have any questions or concerns about your reproductive health, don't hesitate to consult a healthcare professional. Thank you for joining us on this informative journey. If you enjoy watching this video, don't forget to subscribe. Stay curious, stay informed, and we'll see you in the next video.